Hi, my name is Shannon Ripley. I have been a nurse for 5 years on the medical surgical floor. I've also floated all over the hospital to IMCU, PCU, a lot of different units. So I've had quite a bit of experience, which has been awesome. I'm also here in New York City right now as a travel nurse helping out with the COVID crisis, and that has been such an incredible experience. It's very unique. Challenging at times, but everyone here is just so grateful that we're here to help, and I'm so grateful to be here to help them as well, just to give them a break from the craziness. So that's been really good, and that's been awesome. The experience that I've had with evidence-based practice is probably just every day with my patients, I encourage them to get out of bed and to move their body and to sit in the chair, to go for a walk, because it not only prevents screen breakdown, but it expands their lungs, preventing pneumonia. It increases their O2 saturations. Just moving their body gets everything moving and their blood flowing, and I think that that is what increases healing and decreases just the, for them getting worse. And so it improves patient outcome incredibly by just moving their body. So I just encourage them to always be moving. Even if it is just Q2 turns, like that alone can help move fluid in their lungs and then also get, the pressure off of their backside so that they are not having skin breakdown. So that's been a big experience that I've had with evidence-based practice. And the areas that I'm really interested in researching for my capstone is probably hygiene, and how hygiene influences your health so much. And I really do believe, I'm a huge believer in giving my patients baths, showers, oral hygiene, keeping them clean, because I think that is what prevents infections, and that's what also mentally helps them heal, because when they're clean, they feel like a better person. They feel better. And so I think it's a huge proponent of healing. And just, I think that also when patients are in the hospital, they forget about that aspect. They forget about hygiene because they are feeling sick. And then as nurses, sometimes we do get overwhelmed and too busy to really give baths and things like that. But I really believe that is so important, and I really try to incorporate that in my healthcare with all my patients. And so some personal goals that I have during this class is just learning more about research. I have never really done a whole lot of research before in the past, and just learning how to create my own evidence-based practice research thing. So I just want to figure that out a little bit more. And two personal things about myself is that I absolutely love to travel. I've been to 14 countries, and I try to go out of the country every year. I love to travel. It's what I live for. And then another thing is I love outdoor activities. I love hiking, biking, snowboarding, skiing, all winter sports, all summer sports. I've lived in Hawaii. I love surfing, just all the things. Really active, and it is what I live for. So I hope you guys all have such a good day and that we enjoy this class. And yeah, God bless. Bye, guys.